President Obama is visiting Phoenix this week, and it would seem like the perfect opportunity for him to visit the VA hospital there. That was really the hub for so much controversy over the summer. Explain why it's important for the president to visit the hospital.
Well, first of all, he's literally only a mile away from the hospital. I went to high school right next door to where he is speaking, and he could literally walk up the street, take a left, and he's at the hospital. We think it's important that he visits the hospital, the Phoenix VA hospital, because it was ground zero in the national VA secret waitlist scandal. This is where everything began. This is where the first whistleblowers came forward. And quite frankly, the problems of the VA have gotten significantly worse under President Obama's watch. Even though he promised to improve health care for veterans, made all these promises to veterans during his 2008 campaign, things have gotten worse. And members of his administration, people he appointed to run the VA, have whitewashed what happened at the Phoenix VA and have tried to cover up what actually happened with veterans, not just at the Phoenix VA, veterans dying because of these secret wait lists, but across the country as well. And that's been unacceptable. What we want the president to do is just take a walk up the street, visit the Phoenix, and we understand it's not as easy, he needs his entourage and his detail, but just visit the Phoenix VA, send a message that the last 2 years of office, he's going to make VA reform a key issue, a priority for his administration, and for him to finally fix and reform the VA. And we think by going to the Phoenix VA, meeting with the whistleblowers there, meeting with the employees, meeting with veterans who use the facility, he'll send a message that that's what he is going to do. He is going to make VA reform and fixing the VA a priority of his last 2 years in office.
Now, I like that word you just used there, priority. Dan, why is it that this issue doesn't seem to be a priority for his administration?
Well, I think that they believe that all they had to do was throw money at the VA. They just had to increase its budget, and they have increased its budget significantly by about 70%. Just throw money at the VA without any accountability, and that's all they had to do. They didn't need to appoint competent people. They needed to appoint people with new ideas that can effectively manage the agency. They didn't think they had to set standards and fire bad people in positions that they didn't deserve to hold after misconduct. And it's just emblematic of really this administration as a whole. They're very, hands-off. They're slow to respond to problems. They really don't know how to respond to crises and problems. And it's just their solution to everything, whether it's a VA, whether it's the economic problems our country's faced, has just been throw more money at it. And that's really what you saw happen with the VA in this administration. In addition, he put a lot of political cronies in the VA, people from left-wing organizations into the public affairs office and other positions within the VA, and they were looking out for the political interests of the Obama administration and not the veterans they serve. And I think that's why you got to where you are today with this administration and their relationship with veterans across the country and in how they run the Department of Veterans Affairs.
Now, you touched on this a little bit, and finally we'll just hit on this really briefly. Let's talk about the progress or lack thereof with VA reforms. How does Concerned Veterans for America feel the reforms at the VA are being handled and implemented?
Well, we had a bill passed this summer that we thought had some good principles in that bill. And the two principles that we really liked was more accountability for VA employees and also giving veterans more private health care choices in the private sector. There's some other parts of the bill we didn't like. We didn't think they needed to be more money for hospitals and things like that when they've already received tens of billions of dollars, and you're actually going to see the veterans population shrink. So there's a real question of whether or not that extra capacity was needed. But the two key provisions in the bill we thought were really good and would lay the groundwork for some good follow-on VA reform. However, the people that President Obama has appointed to run the VA, unfortunately, have undermined these reforms. In the case of more accountability and firing bad VA employees, they've added extra layers of appeal, which are giving some of these VA managers guilty of misconduct the opportunity to resign or retire or even move to other federal agencies before they are fired and removed from federal service. There's been a lot of stories in places like the Washington Times and others where you've seen VA employees who've been found guilty in investigations of fraud and other misconduct being able to go to like the Department of Treasury, Department of Energy, other federal departments, or they've been able to retire or resign before they're formally fired, and then probably in 6-7 months, a year, they'd probably be able to apply for another federal job and get it without any real retribution, and they keep their retirement benefits and their other benefits they've accrued while VA employee. In regards to the private health care, the VA missed the deadline to roll out the choice card, which was the card that enabled veterans to go get health care in the private sector. And they also set some very weird boundaries for veterans living in rural areas and far away from VA facilities and who they could use that card and those services. For example, a veteran that lives within 40 miles of what's called a community out-based clinic, those are very limited service clinics. They don't provide a lot of services. If they're within the 40 miles of that clinic, they can't use their card like a veteran that's truly 40 miles away from a VA facility. And that really undermines the key intent behind the bill, which is to give veterans far away from a VA hospital, not just a clinic, the ability to use private health care and have more health care choices outside the VA. And that's why we think there needs to be more follow-on reform and deeper and more revolutionary reforms of the VA to finally fix it and ensure that veterans receive the health care and benefits that they earned.
It is absolute insanity, but we appreciate that you, Dan, and Pete, and everybody there at Concerned Veterans for America are on top of it. Thank you so much for giving us some time.
No problem, and call us anytime.